Je suis infirmier, je suis résident de Parc Extension.
The federal program that used to cover medications and essential medical services for refugees was cut in June 2012, and then the federal court declared the federal cuts unconstitutional last July 2014. The government is appealing this decision and would like to reinstore the federal cuts to the refugee medical coverage. We are protesting and hoping that the government will not further appeal the case, and that we will go back to having basic essential medicine coverage and medical care coverage for asylum seekers and refugees. If you're an asylum seeker under the Convention for Refugees protecting their rights internationally, you cannot be refused simply because you have a medical condition or based on your ethnicity or where you're from. Your refugee case has to be heard and then decided upon whether you are granted permanent residency. One case that was brought to the attention of the media was a woman who was an asylum seeker who was pregnant, and during her pregnancy she was also suffering from high blood pressure, but she couldn't have access to some of the medications that were needed to control her blood pressure, and this caused her to have a miscarriage. There have been other cases of children suffering from severe asthma who require daily medication, and because they were asylum seekers, they were not able to afford to pay for the expense of this medication, and these children ended up in the emergency room, which costs the medical system even more. So the government was saying that this was a cost-cutting measure to cut the coverage to asylum seekers, but in the end, really it costs the system more, and it puts people's lives in danger.